I have observed the homeopathy is a vast science. It is very difficult to be a master of this homeopathic system of medicine. And today also time is Retrocerebellar Arachnoid Cyst. Let's have a short discussion on the topics of Retrocerebellar Arachnoid Cyst. Arachnoid cysts are benign fluid-filled cyst-like malformation related to the arachnoid matter. They can be formed everywhere of the cerebrospinal axis with preference in the middle cranial fossa. Arachnoid cysts involving the posterior fossa are less common and are most often found in the cerebellopontine angle. Rarely midline or unilateral posterior fossa, arachnoid cysts exert local mass effects, resulting in the symptoms and signs of cerebellar and brainstem dysfunction. Epidemiology: arachnoid cysts constitute 1% of all intracranial masses and are benign cysts with cerebrospinal fluid as contents. Arachnoid cysts have an increased frequency in mucopolysaccharidosis. Arachnoid cysts appear in the subarachnoid space and are asymptomatic, and common location include posterior fossa, middle fossa in the region of the temporal lobe, and suprasellar region in the region of the third ventricle. Presenting symptoms: most common presenting symptoms include headache with visual disturbances, gait disturbances, and seizures. Rare manifestations include macrocephaly, focal neurological defect, deficit, cognitive decline, and cranial nerve pulses. Arachnoid cysts are incidentally detected on cross-sectional imaging during evaluation for seizures or headache. Diagnosis: on imaging arachnoid, 4 years, male from Bhangar, 24 Organon South, presented with the inability to walk properly and falling down after episode of trembling of the whole body. This was the presenting complaint, and that aggravated when mother scolds him. And when mother scolds him, he starts trembling and goes to beat his mother. History of patient complaints: complaint started when he was 3 years old, gradually increasing, and took allopathic medications. But result was poor. There was associated complaint was dental caries. Past history was milestone of development, all delayed. Intrauterine history: pain in abdomen of the mother during the whole gestational period. Birth weight was 2.5 kg. Maternal grandfather suffered from diabetes mellitus type 2 in family history. And the physical general's appetite was good. Thirst was 2 to 3 liters per day. There was desire for half-boiled egg, sweets, ice cream, aversion fruits, intolerance chips. Stool was regular, satisfactory, urine also clear, so it profuse on the skull and that weights pillow. Sleep sometimes, wake up and cries for at least 1 hour. Dreams, horrible dreams. Thermal reaction, cannot tolerate the extremes of the temperature. And in mental general, oversensitive to the noise, and he was very much obstinate and beats and throws things and used to beat his mother also. And this was the MRI report. That is retrocerebellar arachnoid cyst. Size about 4.6 centimeter into 1.8 centimeter in size. The analysis and evaluation of symptoms. Totality of the symptoms was obstinate, beats her mother when scolded, desire eggs, half-boiled sweets, ice cream, desire sweat profuse on skull, poet's pillow, dreams horrible, trembling of whole body after anger, dental caries. And this was repertorial analysis, and the medicine came first, that is calcarea cough, then phosphorus, then nux vomica, then staphylococcus lycopodium. We have prescribed calcarea phos 0/1 16 dose and calcarea phos 0/2 16 doses OD on 6/8/21. Patient came within 15 days. And they reported that the trembling after waking was decreased, no episode of falling down, only trembling present, some eruption appeared first on the face, then on the skull, itching of the whole body since 2 weeks, and aggravates at the night. And as because patient was relieved within 15 days, they were very happy and they intimated to us and came to NIH. And physical general thirst was decreased, sweat was decreased also. Mental general obstinacy also decreased within 15 days. Oversensitiveness also decreased, and does not beat her mother also within 15 days. Calculus was 0/3 and 0/4 was prescribed. On 27/10/21, trembling of all the limbs after waking up from the sleep again appeared since 1 week, but less than the first visit. Intensity was less. Again become obstinate and again falling down after running long. Does not beat anymore and had an episode of the fever. Itching eruption not present and itching in the region of the anus appeared for last 15 days. Appetite good, thirst was also improved, and again calculus was 0/5, 0/6 was given. In this way, patient was improving one after another, and we continued calculus first. There was improvement in the presenting symptom, there was improvement in the generalities, that is why we did not change the medicine. Calculus was 0/9, 0/10, then 0/11, 0/12, 0/13. And on 29th March 2022, patient is better than before. Trembling of all limbs decreased, falling down while walking decreased, weakness also decreased, patient is playing well, stubbornness increased, talking, taking indigestible things in the mouth constantly still present. Calculus was 0/14 and 15, and now we advise to take in alternatives. And patient come before finishing the medicine, that is why we prescribe only placebo and advise them to continue the same medicine as before. And on 13th June, calculus was 0/16 AD and from also second cup. Then patient was relieved to a great extent. Obstinacy is still present but less than before. Pain in abdomen, does not apply dust on the mouth, does not fall down anymore, does not beat anymore. There was no trembling present, appetite was good, thirst was good, stool was regular, satisfactory, urine was clear, and sleep was sound. And as a continuing of the treatment, calculus was 0/16 was given AD as a continuing doses. Then keep in mind about the tuberculous soil of the patient. I prescribe the king of the tuberculous soil, that is tuberculum 10 mg 1 dose to prevent recurrence of the symptoms. That is still present, trembling aggravation after waking up from the sleep, and for which there was fever, for which he took allopathic medicine. From 1 week, trembling of the body, loss of balance, falling down. Whenever there is an acute condition comes and if patient use the allopathic medicine, it may happen that trigger the situation. Again, symptoms may flare up and come on the surface. And to prevent the recurrence, keeping the in mind about the tuberculous soil, we gave tuberculum 10 mg 1 dose. 22nd August 22, CT scan, no obvious intracranial abnormality was found. There was only adenoid hypertrophy, there and only placebo was given as for 1 month. And this is the report. No obvious impression, no obvious intracranial abnormality. Again, rubram was given. And then he present the keeping in view about the caries of the tooth, we prescribe Creozote 0/1, 0/2, local prescription. And MRI study 19 February 2023. Again, that was CT report, and this is MRI report 19 February 2023. No significant detectable abnormality. This is the report.
কি অসুবিধা ছিল? এখন কেমন
হাত পা কাঁপে? আগেই সেরকম ছিল, এখন কাঁপছে না তো?
তো পেশেন্ট পুরো 1.5 বছর ধরে আমাদের সঙ্গে ছিল, মাঝে খালি